Good morning, Maryland, and thanks for joining us on this special presentation on the WMAR 2 News Facebook page. I'm joined this morning by Dr. James Johnson of GBMC Health Partners. He's an orthopedic surgeon. Dr. Johnson, thanks so much for joining us this morning.
Yeah, thanks a lot, Christian. Thanks for having me.
So just talk a little bit out here heading into the holidays. There's a lot of families might be going in to see their relatives. Sometimes maybe relatives are getting a little bit up in age that they haven't seen for a while. What are some of the concerns people might have about osteoporosis at this time?
Well, osteoporosis is very common as people age. And if you don't mind, I can make it kind of interactive, Christian. But so do you know anybody who has broken a bone in the past?
Oh, absolutely.
So who were they? What was their age? Was it a kid or an adult or middle age?
Well, let's see. Let's talk about myself briefly, because as a news anchor, that may be what I'm best at. But I've broken my elbow. I've broken a rib before skiing. So I've done a few bone breaks now. And I'm not quite into the senior citizen category yet, but I'm getting there fast.
So we see, as orthopedic surgeons, a lot of fractures in young kids because they have what are called open growth plates. So until they get to be 12, 13 years old, and they go through puberty, their growth plates are fairly weak, so they'll often break a bone there. But then there's actually a significant decrease in the number of fractures in middle age, and you do have to be skiing or do a high energy or fall off something like that. Your bone is incredibly strong. So it's actually ounce for ounce, it's 5 times stronger than steel. So when you're a young kid and you have a growth plate, it's pretty common to get growth plate injuries. And I think people kind of get used to hearing about fractures. But as we get older, particularly women in the postmenopausal age, they lose estrogen and their bone begins to weaken significantly in the postmenopausal era. So during that time period, the microarchitecture of the bone decreases, the cancellous bone and the cortical bone that makes it so strong when we're in middle age becomes weaker. And people start to break bones. And what I'd say, as you're visiting family members, or if you're an older person, is it's not normal to break a bone with a low energy fracture. So falling from ground level or slipping, it's not normal to break your wrist or to break your pelvis. And I think we're kind of used to hearing about fractures because they're so common in children. But as we get older, that fracture, that wrist fracture that you get, or anything that's a low energy, we call it a fragility fracture, so standing level or less. If you have that kind of fracture, it can be a little bit like a canary in a coal mine. It can be an indicator that you have this silent disease of osteoporosis, because you would never know about it until you have the fracture. So when you're talking to family members and friends, I think the key message we'd like to get out is that if a person has a low energy fracture and they're over the age of 50, they should get checked out for osteoporosis. And there's simple ways to do that. The best way is to get what's called a bone density scan. That's a simple, very inexpensive test that can tell you how strong your bone is and predict the chance of having another fracture. So it's a long answer to your question.
Well, it's interesting too, doctor, because I know as a surgeon, not very many people get to actually see the bones live. You've actually seen them. When you talk about osteoporosis, and maybe you want to take us through some of the slides that we brought along, but can you actually tell a difference when you see a bone of a person who has developed osteoporosis?
Absolutely. When you're in doing a hip replacement or taking care of a hip fracture, you can feel the difference in the bone. In a younger person, the bone is incredibly strong. Not to gross anybody out, but we use saws and drills, and there are some people where we have to actually you go through multiple saw blades because the bone is so strong. It will be smoking because the bone is so strong. And as you get into that older group and people with osteoporosis, the bone is so weak that you can actually just with your finger push down into the canal. And we have different equipment that we use. Sometimes we'll use this special glue called methyl methacrylate or bone cement, which allows us to glue the implant into these weakened bones. But absolutely, you can tell. And you can see it. So up on the screen here, you have a great picture of the difference between osteoporosis and a regular hip. So on the left side, you have the normal hip. You can see that cancellous bone in the middle, and then the cortical bone, which is like the outside or the walls of the bone. That honeycomb pattern is what makes it so incredibly strong. And as we age, we lose both the cortical bone and the cancellous bone. And the hip, when you fall, takes a tremendous stress. So you end up with these fractures, either the femoral neck or the intertrochanteric area, which can be quite catastrophic. So absolutely, you can tell the difference when you're inside operating on someone's hip.
So I'm wondering then, doctor, if there's the potential for people to do something before that develops so that they can keep their bones strong and healthy going forward into their later years.
That's great. So when you're, the couple key things. One is you want to achieve peak bone mass. So when you're younger, you want to do everything you can to eat a healthy diet, exercise, so you can achieve peak bone density. The second thing is you want to avoid smoking. You want to avoid heavy alcohol. You want to do weight-bearing exercises. And you want to make sure your vitamin D level is important. If you don't have enough vitamin D, you can take as much calcium as you want and exercise as much as you want, but you won't be able to mineralize that bone and make it strong. So you'll have soft bones. The key thing, okay, here on the slide, this is an incredible pic. Do you see this one, Christian?
Yeah, we do.
It's unbelievable. So this is a vertebra. On the left, it's a person with normal bone architecture. And on the right, you have someone with osteoporosis. So the thing you'll notice is on the one on the left, you have fairly thick cortices or walls. And then there's a lot of interconnections. There's vertical connections, but there's actually a lot of transverse connections between. Again, that honeycomb pattern is what gives it incredible strength. So when you're standing up and putting all your weight on your back, you're putting your weight on that vertebrae on the left. Now look at the one on the right. That one is osteoporotic, and you can see how thin the cortical or the walls, the cortices or the walls are of the bone. You can see how thin the cancellous bone, and you also see how there's less of the transverse or lateral connections between the wall. We have a term, Wolff's Law in orthopedics, use it or lose it. And when you do weight-bearing exercise and you put stress across a bone, you tend to make more bone. Now that you will notice that in astronauts who've been in the International Space Station for months, when they come back, they will often lose bone mineral density, and they have special exercises they have to do. But the one on the right is a person who has postmenopausal osteoporosis. They've lost the estrogen, and because of that, they're not making enough bone. You would never know you had this osteoporosis unless you got a DEXA scan or you had that event of a fracture. And a lot of times the first sign of osteoporosis is a fracture, which is unfortunate. So things you can do to prevent it are get that DEXA scan, talk to your primary care doctor, make sure you're doing weight-bearing exercises, avoid heavy smoking, avoid heavy drinking, and get you enough vitamin D and calcium in your diet.
Doctor, does the scan, if people aren't familiar with that type of scan, does that cover all the bones in the body, or do you sort of get an idea of what some of the larger ones might look like and kind of extrapolate?
So it doesn't do you lay down, it takes about 15 or 20 minutes, and they focus mainly on your hips, your low back, and your wrist, because those tend to be areas of your bone that lose a lot of bone density. So they'll usually give you what's called a T-score, which is a measurement or a comparison of your bone health compared to a healthy young person. So if you're a minus score, that's going to tell you that you're 1 or 2 standard deviations below what the healthy bone density would be. Interestingly, bone density is not the end-all be-all for osteoporosis, and that's why we are so laser focused on fractures in osteoporosis. You can have a fairly normal bone density or mildly low, what people call osteopenia, and still have weak bone. And the structure is what makes them is so incredibly important with osteoporosis. So if you have a mildly diminished bone density, say a T-score of -2, and you don't classically get diagnosed with osteoporosis based on that, if you fall and break a bone, that can tilt you into the category where you do need to get formal treatment for osteoporosis. So it's important to talk to your primary care doctor or your orthopedic surgeon about a history of fracture. So here's another great picture, healthy bone versus osteoporotic bone on the left. You can see how thick those connections are, that incredibly strong bone. And then on the right, the osteoporotic bone. I think we might have one more slide that we're going to put up, and we can show you a little bit about how that happens. But you would never know you had this weakened bone unless you fell and fractured or had a bone density test.
So let's say someone were to get the bone density test and realize that they do have that low score, indicating that there's an issue that could lead to, you know, a further danger of a fracture with even a regular fall at some point later in life. Are there things that can be done that can actually get the bone growing back in a more healthy way, or is it just a downhill slide at that point?
Yeah. So all those things I mentioned, the key things, there's simple things you can do on your own: weight-bearing exercise, you know, avoiding the alcohol, avoiding drinking vitamin D and calcium. There are some medications available, and this has been expanding over the last 20, 30 years, so that there's really a lot of options now. Some of them are well known to people, such as Fosamax or Lendronate. There's cheap and expensive options. They do have some side effects, and it's important to have a discussion with your primary care doctor or orthopedic surgeon or endocrinologist, whoever's taking care of your bone health, because you need to pick the right medication for you. If you're incredibly high risk for another fracture, you should probably start on one of the medications that actually build new bone. But those medications can be more expensive. They require daily injections, and they can have some side effects. So we want, so here we have in the summary, we want everyone to know that if you've broken a bone, what we call a fragility fracture or a low energy fracture, so standing level or less, you are high risk for a future fracture. And it's important to get tested. There's interventions that we can do, simple ones, inexpensive ones, like the weight-bearing exercises and avoiding alcohol. And if you are at high risk, it's really important to get checked out. We have a program here at GBMC called the GBMC Healthy Bone Service, run by Julie Merrill, who is dedicated, again, laser focused on preventing hip fractures. You know, if we had one goal here, is we want to prevent people from having hip fractures. So what we can do is get your bone density tested, test your vitamin D levels, check your kidneys, check other secondary causes of osteoporosis like hyperparathyroidism, and we can get you on the right treatment. Most people are going to be treated with simple things, simple fall prevention, for instance. We have a saying in orthopedics: if you don't fall, you don't fracture. And a lot of the focus is on balance and making sure that people don't fall, because as you get older and the bone gets weaker, you also have an increased risk of falls.
Yeah, doctor, I just think it's very interesting, and it's an important message for people to hear, that even if they happen to be diagnosed with actual osteoporosis, it is possible, even at, because I think once people get past a certain age, maybe you think you're done growing, maybe you think you can't have any response to actually growing new bone or even new muscle in some cases. So you're saying, though, that there are things we can do that actually will grow or improve the bone structure and possibly prevent a fracture from a fall at a later time.
Yeah, absolutely. If you guys could fast forward, there's a slide in there from New England Journal. It's a cartoon showing some of the different cells involved, but it's a little bit hard to understand it unless you actually see the picture. I'll see if it pops up here. But you have two kinds of cells that are really important: osteoclasts and osteoblasts. Osteoclasts are the diggers, and osteoblasts are the builders. So imagine if in your body you are constantly making new bone, constantly repairing. A good analogy is the infrastructure. So everyone's focused on the infrastructure bill. So if you didn't regularly repair your bridges and your roads, you would have potholes and you'd have cracked bridges. The same thing with your body. You are constantly rebuilding your body, making new bone. And the way that we do it is with this remodeling process. And it's a simple thing. The osteoclasts come in, they dig out a pit, and you can see it on this picture. The green cells are called the osteoclasts. They come in, they dig out the damaged bone, and then the osteoblasts come in and they make new bone. They make sort of a softened bone or a matrix, which is then becomes hardened and calcified. Some of those cells then become trapped in the bone, and they become what are called osteocytes, and they have some neurologic activity. So they can actually sense if you're putting weight across the bone, and they will tell your body where to make more bone. So the medications that we have are based on this process, this remodeling process, the rebuilding. When you become a postmenopausal, if a woman loses estrogen in their body, estrogen is anabolic, so it tends to make new blast cells, so osteoblast cells. When you lose that estrogen, the osteoblasts don't work as well. So you have these digger cells that keep working, but the builder cells aren't working anymore. So we can give medications that actually slow down the digger cells. And that's what most of these medications are, alendronate, Fosamax, and all those medications. They actually slow down the digger cells. So the problem with those medications is if you're on them too long and you stop that remodeling process, the potholes will build up and the cracks will build up and you can get brittle bones. So you have to manage these medications. There are some newer medications that are really interesting, and they've been out now almost 15 years, and they actually are anabolic, meaning they cause you to make more bones. So they activate the osteoblast cells. So there's lots of different options. And if anyone watches the nightly news, as I do, you'll see a lot of the advertisements for these medications on all the time. But it can be confusing for patients, and it's important to talk about it with your doctor, or certainly if you have any other questions, I can answer them. But
yeah, doctor, it just sounds like the message is that the first step might be talking to your doctor about it, and then potentially as you get a little up in age, think about that scan.
Yeah, absolutely. And other things that actually can raise your risk of fractures are, so if you've had a prior fracture, if you've been on prednisone or steroids for any reason for a long time, if your mother had a hip fracture, which is fascinating, that can raise your risk of fracture. So simple questionnaires and just talking with your doctor, a lot of the history can really help tell us whether or not you're high risk. So this is a program we have, the GBMC Healthy Bones program. Here are some core interventions that we used for the program. So calcium supplementation and vitamin D, weight-bearing exercises, fall prevention, smoking cessation, limiting excessive alcohol, pharmacotherapy, or that broad range of medicines that help to affect that remodeling process, getting your DEXA scan, and then communication. So we write a letter to the primary care physician explaining what we're doing. And it's important to have really good communication. And then we want to write a letter to the patient so they understand what's going on, because it can be a bit confusing. We're giving you a medicine that's going to help prevent something that hasn't happened yet. And that can be very confusing for people. And they say, well, is it really worth it to take a medicine that has a risk? And so our job is to go over that risk and benefit and help them understand which medication might be best, what the options are, and what the best, safest option is for them.
Okay, and before we go, Dr. Johnston, can you just let us know how we can get in touch with you over at GBMC?
Yeah, thanks a lot, Christian. And so Julie Merrill runs our program here. I work with Julie, and the phone number is 443-849-3838, and it's the GBMC Healthy Bones program.
Okay, Dr. James Johnston, a fascinating discussion. Thanks so much for doing that this morning. An orthopedic surgeon with GBMC Health Partners. Thanks so much, and have a happy and safe holiday.
Great, you too. Thanks a lot, Christian.
Thank you.